There's the.
Okay.
All right. Oh boy.
So Dr. Roney, you're in the shot also.
Okay. Yep.
If you do
Do
want
you
to
want me to
some,
get out of it?
no, that's
Oh,
fine.
Okay.
This actually works fine. And if you do want to explain something, I am recording audio. It's
Yeah.
so,
Yeah,
but
and
I may
I
not
wanna
use
get
it
some
tonight.
feedback,
But this
so-
this might be good for something in the
Oh
future.
yeah,
In the
for sure.
future, yeah.
Okay.
Yeah.
Okay, so we drew blood. Miss Theresa, who has what 20 plus years
Yep.
experience of live blood analysis, has put my blood under the microscope, is now taking a look. So this is the first part of it. So let's see. There's something moving there. I don't know what the heck that is, but talk to me.
Okay, so that's a red blood cell.
Okay.
And it's a little bit misshapen. It's called an echinocyte.
Okay.
So sometimes those are misshapen because of low B vitamins.
Mm.
Sometimes it's showing there's a liver issue going on. Sometimes a viral.
Mm.
So there's lots of different reasons why blood cells can be misshapen.
Mm-hmm.
And so I just provide that information for the doctors here so that they can take into account that clue along with all the rest of the patient history.
Interesting. And
Okay.
I did have just to correlate. I'm getting over a viral infection. Probably that was strong about 2 weeks ago. So maybe that's it. So then
maybe
at
so,
least
yes.
we can, as a patient, can give feedback to the doctor.
Yes.
As they evaluate this,
Right.
and then they
I
can
also put that
correlate.
in my notes. So when I look at the blood, I don't really have any information about the patient at all.
Gotcha.
And I use the blood just to see what's there.
Sure.
And then, but if the patient discloses something, then I add that to the notes when I give it into the patient portal for the doctor.
Gotcha. Okay.
So that the correlation does get there,
Okay.
right?
All right.
So
Perfect.
the red blood cells, just again for your
Uh-huh.
information, live about 120 days on average.
Gotcha.
So a 2-week-ago virus could definitely be affecting this,
Gotcha.
right?
Fair. Okay.
So
yeah. What else are we
The other
seeing?
thing in this picture that we see, we have a lot of hemolyzed red blood cells.
Okay.
So they're hemolyzed, that can be from oxidative stress. It can also be from not getting enough good fats
Interesting.
on that
Okay.
outside membrane.
Yep.
Like, see how this one has such a bright halo?
Yeah.
That's the light from the microscope shining through the lipid.
Oh,
in the
interesting.
membrane.
Okay. And that's a good thing.
And that's a good thing.
Yeah, okay,
Because
gotcha.
that lipoprotein membrane is the gatekeeper, what gets in and out of the cell.
Gotcha.
And so if you have a weak one,
Mm-hmm.
then it doesn't work as effectively.
Gotcha.
Right.
Okay.
So then we also have here, this is some platelet aggregation with a little bit of fungus mixed in.
Mm.
And then this is a lymphocyte. I can't tell if it's a T cell or a B cell,
Okay.
but it's already disorganized.
Mm.
So that could be because you've been fighting a virus.
Gotcha. Okay.
So that count could have been up and now it's coming down,
Coming
so they
down.
have to die off.
Okay. Gotcha.
Right?
All
So
right.
that's all in that one little
One
picture.
little. Yeah.
And so just for reference, it takes about 14 of the red blood cells to fit across the diameter of a human hair.
Mm.
So we're looking at maybe 2 hair widths.
Wow.
here.
Yeah. Right.
Right.
Not much. You're
Not
just
much,
getting
yeah.
a small sample size.
Small sample size.
So then obviously you'll then
Yep,
move.
I'm moving the
Yep.
slide around,
Yep.
yeah, so that we
Okay.
can see more of the sample.
Yep.
So here we have another lymphocyte. This one's still working. This one is now a leukocyte. These are what we kind of call the trash trucks. They
Yep.
pick up what's not supposed to be there.
Yep.
Or if you think of your immune system as an army, they're the infantry.
Yeah. Gotcha.
Right? They're picking
Okay.
up the trash.
Yep.
And that
gotcha.
one is disorganized, again, because possibly been fighting the war,
Sure.
right?
Yep.
Do you feel a lot of fatigue?
No, fatigue is really not a factor. My energy has been really good, but I am still fighting,
Uh-huh.
something.
Because with the hemolyzed cells, they don't carry oxygen as effectively because
Interesting.
that membrane isn't strong enough to hold onto it.
Gotcha.
So fatigue is one of the most common symptoms that we
Yeah.
see.
Yeah, no,
And so
interesting.
and you can see quite a few echinocytes.
Yep.
Yeah.
Interesting. Now, on the screen, what would a healthy red blood cell look like? Is there
I was gonna say it would look more like this one.
more like that one, more
Or this
darker?
one.
Yeah,
A little bit
right.
darker, a
Wow.
little bit brighter halo.
Yeah, most
Yeah.
of them look hemolyzed.
Yeah.
Right?
In this area for sure.
Yeah,
We might move into another area where you've got more that are
healthier.
Stronger and
Yeah,
healthier,
stronger,
yeah.
but not a ton. A lot look hemolyzed.
so here we're coming into a better area.
Okay. All right, so that's, yeah,
There you go.
okay.
So let me focus out
Wow.
better, yeah.
What a difference, you know, you could see the
Yeah.
difference as far
Okay.
as good versus bad, right? So,
Yes, and I try and put that into a little bit of a percentage for the doctors, like
Yeah.
if we see a lot of hemolyzed,
Yeah.
I'm gonna go back and kind of go at the end
right,
and say, oh, it looked like about 20 or 30%
yeah,
were hemolyzed.
hemolyzed.
Right, that way
okay.
they have an idea.
Yeah,
I don't do actual counts.
Sure,
I'm just
sure,
doing
you
kind of
just-
a visual
sure.
estimate
yeah,
because
absolutely.
they get enough counting types of tests.
Right, and I'm
Right.
sure your experience, you know, you 20 plus years,
Yeah.
you can look and get a
Yeah.
good idea. And so there was one fact that I thought was interesting to let the audience know, which was there's quantitative and qualitative.
Right.
So can you explain that real quick? I think that's
So
important.
this is definitely looking more at the quality of the cells
Yep.
than the quantities.
Gotcha.
Like I said, I don't actually do physical counts,
Sure,
but visually I can kind of tell.
right.
But when you have a regular blood test where they take tubes out,
They're measuring,
they're measuring,
Right.
and
which
usually,
is quantitative.
which usually a computer counts first.
Sure,
And that's why sometimes, like when you go, they'll take several tubes, and you'll get one with a purple top and a yellow top and a blue
Right.
top,
right.
because those different color tops say what they're measuring.
Yeah,
Right,
for
if
sure.
you're doing a lipid test, it's one color. If you're
Yep.
counting a CBC, it's you know what I mean, another color. And
For
so
sure.
the chemicals or the reagents that are in those tubes help the computer count what
right.
they're looking for in that test.
And then they're measuring based on what has been studied to be quote unquote normal.
Correct.
So the comparison here is they're not doing the count necessarily, although generally there is some. They're really looking at the quality. So if you saw the hemolyzed blood, right, and
Right.
on the other slides, and now you're seeing the quality of these blood cells, which are very good, right,
Right.
compared to hemolyzed before.
Right.
That's the quality that you're looking
That's
for.
right,
Yeah.
exactly.
Just
the
to give
quality.
the audience a little perspective there.
Right.
So, and then the main purpose of us doing a live blood analysis, I mean, I know the benefits are outstanding, but tell how clinically it could help a patient.
Okay, well, in particular here, a lot of times it's helpful for patients to see how the therapies are working.
Right,
And so if you look at your blood before you start or at the very early part of your treatment,
right.
and
A
then
measuring stick, so to speak.
and then you look again,
Right.
you know, after you've gone through your protocols,
Yep.
or sometimes even we do it right before and after a specific
Yeah,
protocol,
right,
then we can see how it's working for you.
right.
Because that's one of the 4 pillars, right?
Yeah.
That you want to personalize the treatment.
Yeah,
And so when we can see things, for instance, just say, we'll just take hemolyze for
Yeah,
instance,
right.
because you had that.
yeah,
Now you can go and talk to the doctor
right,
and say, maybe I need more good fat.
yeah,
Maybe
right,
my liver's not breaking down the fat I'm taking.
right.
Maybe,
right.
you know what I mean?
Sure.
Everything plays into that.
Yeah, for
so
sure.
that you can personalize more.
Yeah, put some strategies together to clean it up. I think
Exactly.
the one thing I'm due for another EBU. So after being sick, getting the oxygen and ozone to those cells is going to really rejuvenate the mitochondria and probably clean up some of the mess
Yeah.
that's here. So I'm curious to see if I do an EBU, say this weekend, then have a redo.
Recheck
And let's
how
see
it's
what
doing.
those hemolyzed blood cells look like, and even some of the other things
Yeah.
that you're seeing from an immune standpoint. So
Correct.
yeah, so
Yeah.
okay, good, yeah. Well, that makes me feel a little bit better. There's
Yes.
some
Oh, yeah,
better
there's-
blood cells there.
Yeah. I know you were getting worried.
I was a little nervous, I'm not gonna lie.
Yeah.
But I did fight a pretty aggressive infection. We went away, and we had moved 2 weeks before that every weekend, and so anybody that's moved knows that that's a chore.
Yes.
So between work and moving, I was just tired, and
Yeah.
so you're tired, you're worn down, you're exposed to something,
Yeah.
and that's how
And
sickness.
and that often happens with people who are like high energy, working, go. When you take that few minutes to relax,
Yeah,
it's
that's
like
when
bam, that's when it hits you.
Yeah,
That
so
happens a lot.
so I had a pretty bad upper head and chest cold, which I haven't had a chest cold in probably 45 years.
Wow.
So whatever was going on, it was pretty strong.
Yeah.
And that's the way illness works. If your host, yourself, is susceptible and you're exposed, then you have more of a chance of getting sick. But that's the whole idea is we do have control. If my body's strong and healthy and I'm exposed, my body should fight it. But looking at it, I was worn down, and it makes sense why I got
Yeah.
sick. So again, looking at the blood after that, see what's going on. We could do some modalities and some treatments, and then I can re-look at the blood to make sure I'm moving in the right direction. So great
Right.
point.
Yep. And I was going to say, and a lot of the modalities here are directed at helping to build the immune system,
Correct.
which is what everybody needs who's fighting anything.
Supercharge the immune system, get your liver working better, your gut working better,
Yep.
immune system, etc. So,
Yeah.
right. So something like that, is that one of
So
you?
this is a disorganized white blood cell again.
Okay.
It's got a little bit of fibrin around
Uh-huh.
it, and some of the bacteria that it's collected at some point has escaped now. These
Mm.
little kind of
Is that what
floating
that
around.
is? Yeah.
Mhm.
Interesting.
So now that's kind of like, I say, it's like a trash truck that broke down on the way to the dump.
Wow.
Now another trash truck has to come and clean up the mess.
Oh, so there is some
So-
bacteria that you're
Yep.
seeing floating around there.
Yep. So
Okay.
this is a lymphocyte right next to it, so they
Okay.
might be on their way over to help.
Okay.
This is a little bit of platelet aggregation,
Okay.
which platelets are our clotting factors. They're supposed to be circulating all the time so that if you do have a poke or a
Yeah.
cut, you stop bleeding.
Okay.
Right? But you don't want them to be aggregating into really big clumps in your bloodstream because that makes your blood
Wow.
thicker
Yeah.
and harder to get through the capillaries.
Yep.
So I generally advise anything bigger than the red blood cell, we want to do something to try and minimize that.
Gotcha.
Right?
Okay.
So like this is perfect. That's
Mhm.
just one
That's a
single little
platelet.
platelet. This
Okay.
is a whole grouping of them.
Gotcha.
So,
Interesting.
um,
And why would something like that happen?
Stress.
Yeah.
It's liver.
Liver.
Liver enzyme triggers it. So
Okay.
if your liver's not functioning really well, that can trigger it.
Okay.
Two things I know that help to break it up is just good omega,
Right.
fish
Which
oils
I take,
or whatever, and then also nattokinase.
Okay,
Those
yeah,
are both
yep.
things that help to break
So
them
the
up. that-
Neprinol, there's a product called Neprinol that we have that has nanokinase in it.
Yes.
Really good product. So okay.
So yeah, I'm not familiar necessarily with the
Sure,
products that they
sure.
have here, but that's not my place.
No,
That's
sure.
for the doctor.
You're you analyze
I
and then
just
you
say
report.
what's there and kind of like an ultrasound tech.
Our job
this is
is
what's
then
here.
to-
Then
to
you take that information
Create the protocol.
and create the
Love
protocol.
it.
Yeah.
Love it. Okay. That's pretty interesting. They just see those
Yeah.
little bugs almost.
Yeah, they are little bugs.
Yeah. Right.
Definitely.
That's what they look like. Okay. All right. Got some work to do for sure.
So here we have a couple of little cholesterol.
Interesting.
So that's another liver sign
Mm.
because the cholesterol, we use it to make our hormones, to make the lipid membranes. The liver produces it.
Right. Sure.
Mainly, right?
Uh-huh.
We do get some dietary, but mainly with the liver is what produces it.
Yep.
And so when it's in a little bit bigger chunk than it should be, then that's another liver sign.
Yeah, okay.
Right?
So the liver's coming up quite a bit here. So my next step would be probably do some blood work on what they call a complete metabolic panel, which tests your liver enzymes, ALT, AST. That will be a next step for me, just seeing this to make sure. And just quick caveat, a few months ago when I did it, my bilirubin
Uh-huh.
was a slight hair up, just a 1/10 of a point up. And I went to John, who does the ultrasound, and somehow, some way, I had a small little gallstone.
Oh.
So there's correlation here, which is, again, that's where the clinician's job is to talk through the patient's history and make sure, okay, we're seeing this, we're correlating some things on blood work, other blood work, we're correlating things on other tests, and now we can get a better, more individualized plan for me, even personally,
Yes.
based on this. So,
Yes. The good news though is that these are still smaller than the red blood cells,
which is good.
which is good because
Right.
they don't cause any circulation issues.
Gotcha.
But I've seen bigger than the whole screen
Wow.
in some
Interesting.
patients, so
And
it
would
can be
the,
really bad.
not to interrupt, sorry about that, but would there be some normalcy to, like, quote unquote normalcy, or when you see that it's like
It's
shouldn't be
a little-
there.
Shouldn't be there.
fair?
Yeah.
Okay, good to know.
Smaller obviously is better,
Yep.
but yeah.
Okay, good to know.
So one a little bit oval, I'm just gonna kind of keep
Yeah.
my eyes open. Ovalocytes can sometimes be an indication of a hormone imbalance.
Interesting.
Not always the like testosterone or
Gotcha.
estrogen, even
Like
just
an
stress
insulin-
hormones.
Stress hormone, like cortisol.
adrenaline
Okay.
too. So we'll see how many we see like that.
Okay.
Again, I'll put that kind of percentage in the report for the
Yep.
clinician.
And then
Yeah.
something like this here.
So
it's
that-
abnormally
Yeah, so
shaped.
sometimes it's called a crenating membrane. It just means it's misshapen,
Okay.
and that can go back to those good fats.
Okay. Good
Very-
fats. So
very
maybe
easy.
fats.
Yep.
I take
Which,
them. I
I
do
was
a lot
gonna
of good
say-
ones. However, the liver
Exactly right.
may
Yeah.
not be functioning the way it needs to be. So I'll have to look
Yeah.
into that more.
So just another little
Little
piece of
cholesterol.
cholesterol,
Mhm.
and another little fibrin net. So you can see that looks like a
Interesting.
little spider web here.
Yeah.
Yeah, so that's a liver sign as well.
Mm.
But most of your red blood cells look really good.
Yeah. Now they do.
Yeah,
Before it was
I
a
was
little, I'm
gonna
not
say,
gonna
yeah.
lie, I was a little nervous.
So a few
Wow.
little, again,
Yep.
chinnocytes a little bit
interesting.
misshapen, but
Yeah.
as long as the majority of them are looking good,
Yeah.
then we can take those other little signs,
Sure.
right?
Yeah.
And say, like you said,
Clinically
just
apply
a little
them.
bit.
Yeah. There's definitely some things that I could work on or follow up with to get better detail on strategies, right? After I'll do some blood work and maybe do an ultrasound on the liver and just see,
Yep.
redo that.
Yep. Here you have a little bit, kind of a nice big cockeye there.
And what is that?
It's a bacterial.
Is
a
it?
little, just a round bacterial form
Interesting.
cockeye.
Okay.
Yeah. So we don't live in a sterile environment,
Right.
so we have some sometimes.
Sure.
You just want to make sure that it's not overwhelming the immune system.
Right.
So here's another
Right.
little one here.
Yep. See it.
So that might be even what you were fighting.
Mm-hmm.
You know, just hanging out.
Yeah. Okay. And then something, I know this is at the far end of the screen.
Yes, I'll bring that in.
Yeah.
This is a nice active white blood cell, actually.
Is that what it is? Okay, so it's doing
So
its
this
job.
is, yeah, I'm gonna switch the lighting right
Okay.
now so we can see the nuclei, so we can try and determine what kind of white blood cell it is. Looks like a neutrophil to me.
Mm,
Neutrophil is the most common.
Yep. Can do a lot of different
lot of
jobs in
different
the
things.
immune system.
Yeah.
So immature white blood cells are things like neutrophils, lymphocytes, basophils, eosinophils, and they do different things. So for instance, if you see a lot of basophils, it's usually bacteria. If you see a lot of eosinophils, there's usually some gut infection or something like that
Or
going on.
sometimes parasites.
Or parasites, right?
Yep.
Usually in the gut, right?
Yeah.
So yeah,
Yep.
okay.
Yep.
Yeah, interesting. So a little neutrophil there.
Yep.
Now, so with that history that I gave you,
Mm-hmm.
would you expect, say I was fighting it now, I mean hardcore, would you expect to see a lot more of this on here?
Yes.
Yeah,
Yeah.
that's right.
Like I was gonna say, just visually, your white
Doing
count
okay.
isn't really high.
Yeah, okay.
So I think you're good as far as that goes.
Yeah, I'm on the tail end,
yeah.
right, as far as this live blood analysis would
Yeah.
show, correct? Yeah,
Mhm.
good.
Just for your information, the ratio is 1 white blood cell to 600 to 800 red blood cells.
Oh, gotcha, okay.
Visually.
So one white blood cell to 600 to 800 red blood cells.
Yeah.
So that's good.
Yeah.
And again, that gives you a general idea when you're going through this.
Exactly.
You're pretty good, or we
Yeah.
have a problem. And that you can be that general with your analysis,
Yes.
right?
Yep.
And then that's what you report.
Yep.
Without counting it so much is what I'm
Exactly.
saying.
And
Okay.
so this actually is a basophil. It's
Okay.
nice and active. They look
Mhm.
different than the neutrophils because they have real big granules.
Okay, yep.
Right? So you can see the granules moving there. It's moving kind of down and to the right. And so it's on the hunt.
It's on the hunt.
basically, yeah.
Wow, crazy.
And everybody has some.
Sure,
It's
sure,
normal.
sure.
Most people don't get to see theirs.
Right,
So this
right,
is just
right.
a nice curiosity.
Yeah.
You get to see them. This is your immune system in
Doing
action.
its job.
Doing its job.
Under pretty normal circumstances,
Yes.
right? As
Yep.
far as you could tell. Now, if you saw a lot of those, now you know there's probably
Exactly.
some bacteria
Right.
or something
or
like
sometimes
that
too,
going
they
on.
react to histamine.
Right?
So that can also
That's true.
be an indication of allergies.
Yeah, okay.
Or sometimes dehydration. We produce histamine when we're dehydrated
Okay,
too. So
yeah. So histamine is when there's an active response by the immune system. One of the cells that shows up is called a mast cell. And that mast cell basically does its job and then explodes, if you will, and then histamine or prostaglandins are released, which produce histamine. So
yeah.
just a quick,
Yeah.
quick brief immune system caveat there. Okay.
Yep. Couple more.
Couple more, okay.
So they make up about 3 to 10% of
Okay.
your white blood cells usually.
Okay. And these are basophils again.
Basophils
Yeah.
again, yeah, because they have the bigger granules.
Again, immature white blood cell, but specialized.
And then here we have some fungal signs. Oh, there's a double head cockeye.
Huh.
So
Oh,
fungal,
fungal.
the
Mm.
fungus that most people are aware of is Candida.
Yeah, right.
But there
Right.
can be other ones.
Yep.
I can't necessarily define which
Sure,
one this is,
but
so
still.
I just say it's a fungal marker.
Yeah, good
and
enough
then-
for me,
And then
right?
the doctor knows what to do with that.
Okay, so again, with that these fungal markers that you're seeing, is that something abnormal? Meaning, should this be probably treated?
Okay, so
Yeah.
let's say it's average,
Yeah.
maybe not optimal.
Gotcha. You got
Right.
it. Okay.
So I see a lot of people dealing with it, and it's probably because more and more people are dealing with a little bit of leaky gut,
Gotcha. Okay.
because it's part of the flora
Sure.
that we're supposed to
However,
have.
however,
But
when it becomes
shouldn't
too
be
high,
in the it shouldn't be in the bloodstream.
gotcha.
right?
Ah, gotcha.
'Cause I
Good
say-
to know.
When it's in the gut,
Yeah.
we're sharing our table.
Sure.
It's eating off what we ate, and
Sure.
it actually helps us to break down our foods and create B vitamins and all kinds of things.
For sure.
But when it's in the bloodstream, you don't have food floating around.
Gotcha.
So now it's gonna steal your energy.
I gotcha.
Right?
Good to know.
And then the part we don't like to think about is when they eat, they have to excrete.
Yeah. Right.
So that goes into the bloodstream,
Yeah,
and
which
that's
is
an exotoxin that
exotoxins.
your liver and kidneys have to filter out.
Yeah.
So that might be contributing to some of the liver issues that we're seeing.
Sure.
The little signs that
Yeah.
we're seeing that the liver is saying,
That's
Hey there.
fascinating. Yeah, it's fascinating. I mean, this is fantastic. I mean, fungi in the bloodstream.
Yeah.
I'm glad because there's. I always say, well, what's a normal? I don't want to say normal, but there's probably, as Theresa explained, in the gut example. Candida is normal in the
Right.
gut, right?
Yeah.
However, when it gets too high, it becomes infectious.
Right.
The immune system has to deal with it, and a lot of people have that. So here, when you see it in the bloodstream, that's kind of abnormal.
yes,
It shouldn't be there.
correct.
Right. Okay. So
Yes.
that's good for me to know,
Right.
even as a clinician, not just a patient, because that's something we want to go after. Because
Yep.
fungi is definitely a big factor in chronic disease,
Yes,
especially cancer. So
exactly.
this is very relevant. Okay.
Yes.
So again, if I'm trying to prevent, I want all the data that I possibly can get in order to clean up. No different than if I'm trying to clean up from cancer or some
Right.
chronic disease, or I'm trying to prevent it future.
Right.
Knowing things like this, I think, give you that power and that control,
Exactly.
and I think
always
that's
say knowledge
fantastic.
is power.
It's
Or
power.
at least potential power if
Yeah.
you use the knowledge.
I mean, I'm certainly going to act on this ASAP.
Yeah.
So, yeah, this is great.
And just for your reference, it's not a lot comparatively
Sure.
speaking. I
No,
mean,
but in my opinion, I want to be
you
as
wanna
clean
be
as possible.
right?
We use this term on our cancer conversation: fuels to the fire. Right? If I have too many fuels igniting the inflammatory fire, that's when damage occurs to the cells. So the less fuel, the less fire, the less damage. So getting rid of things that we're seeing here just gives my body a better chance to stay healthy and reduce that oxidative stress at the cellular level.
Correct.
So good info, great info.
So again, a little bit more,
Yeah. Okay. Yeah. Seeing it. Now we're seeing more
a
of
little
that.
bit more.
Okay.
It actually, the little white bubble that we're seeing is actually caused by the fungus fermenting. It's not the actual fungus that
No,
we're seeing.
for sure, but it's
So
the sign.
the longer it stays on the slide, the more it occurs,
Ah,
right?
yep.
So that's part of the reason why I spend an hour
Mhm.
most of the time with each client, because if I didn't spend that time, we wouldn't see it.
Yeah, gotcha.
Right.
Right,
And
sure.
so we want to make sure that we can see it.
You're going through pretty
Yes.
much every square inch, if you will, of the slide,
on the slide,
of the
right.
blood, right?
Yeah.
And then, so what we're seeing here, there's little something moving.
Yes.
What are those?
So I don't know if that's the actual fungus or
Uh-huh.
if it's bacteria that's attracted to the
That
fungus.
it's attracted, yeah. But
Yeah.
there's definitely, I don't know if you
Yeah.
can see it, but there's definitely little critters moving in there. So
Yeah.
really interesting. Okay.
Yeah.
Some more of those hemolyzed
More of
blood
those
cells.
hemolyzed, yeah.
And again, just to recap, the hemolyzed cells, main causes?
Oxidative stress,
Stress, yeah.
and then not getting enough good fats or breaking down your fats and utilizing them,
Gotcha.
right?
Okay.
So people say you are what you eat,
Yeah.
but it's really you are what you utilize from
What you
eat.
utilize, yeah, because I do get a lot of good fats. Avocados consistently, coconut oils, your good oils. I do a lot of raw nuts and seeds, so I'm in that mindset of, proteins and fats dominate my meal with a low carb. So I'm getting plenty of fats, which tells me I may not be breaking them down, which again goes back to the liver. So I'll have to do a follow-up on that for sure. And they're moving. They're, you know, those
Yeah,
things
they're
are moving.
yeah.
Cool stuff.
So this is a nice, strong white blood cell,
Gotcha.
because he's taking that fungus out,
Yeah, I
right?
gotcha.
So
It's almost like
he's-
Pac-Man, if you
yeah,
could see.
he's trying to
And
engulf
almost
it.
engulf it
Yep,
and kill
take
it,
it out.
and take
yeah.
it out.
So
Wow.
that's a good sign.
Yeah,
Sometimes they tow it too to try and get it out.
Is that right?
Yeah.
Interesting.
So
Yeah, it's actually moving more and more
Yep.
in almost engulfing it.
yeah,
Pretty
it's
well.
also one of the reasons why we often see the fungus right around the platelets, because the platelets kind of disguise them. Like say they're trying to hide from your immune system
Oh,
by using your own proteins.
interesting.
So they're pretty smart little
Yeah,
critters.
no question.
Yeah.
Wow, that's great.
So here's a kind of a big grouping of platelets, maybe
Okay.
just a little bit of fungus there in the center where the white
right
is.
Here, right?
Yep. So this is again one where I would say this is you want to do something to break that up.
Sure.
Because you don't want your blood to be thicker and thicker.
Sure. And that's the nanokinase,
Right.
right? As one.
Mm-hmm. And fish oils.
Fish oils,
Those
yeah.
are the two.
Yep, okay.
Another double head cockeye.
Yeah. And then the significance there is that
Just
double
Usually-
head cockeye is what
It's-
Theresa said.
yeah. So most of the simple like flora you would say from your gut is
Yeah.
just a single.
Okay.
So usually if you look up any different, I can't tell what kind of bacteria it is
Yeah.
from this test,
Sure.
but the ones that are more pathogenic usually are either doubles,
Okay.
chained together,
I gotcha.
long bacilli, things like that.
Just
So
single
might
is
be-
good, more different than that,
Yeah.
no problem. Fair. That's
Yeah.
fair. Yeah, definitely see some fungi.
Yeah.
It'll be interesting for me to put a plan together for myself, right? And then redo this in say, what would you say, a month if we did if I
Yeah.
did a protocol, I'm gonna do the EBU
Yeah.
again, get the liver checked out, maybe do a detox, maybe a liver flush, things like that, I think would be helpful, and maybe even do some antifungals, either natural or medication is what I'm thinking.
Yeah.
Would you say, just in your opinion, even just a quick overview, that's probably the good direction?
I'm not a
So-
doctor, but
But
yes,
that's what you
definitely.
would, based on that, you would tell the doctor, look,
Yeah.
look into this, look into that,
Yeah.
those things so far.
Yeah, and I
Probably-
often do that to the patient, is give
Yeah.
them a list of things to talk to the doctor
Yeah,
about.
perfect.
So they remember.
Yeah,
Yeah.
good. Love
So, okay, now we're gonna
Alright.
look at the second slide, which has 8 drops.
8 drops of blood, so boom, 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 boom.
And so
4 and
each
4.
one of these
Uh-huh,
goes deeper into your body and further into your history.
interesting.
So the first one is like your freshest blood
Uh-huh,
that comes off
so, okay,
on the
so,
slide,
yep,
because it
freshest
hasn't
blood.
been around as long and hasn't picked up as much toxicity, so it weighs just a little bit less.
Yeah, gotcha.
Physics,
Yeah,
right?
right, sure.
So that's how we go down
Yeah,
to the smallest drop is the deepest. Sometimes we always find underlying
all right, here we go.
chronic things,
Here
right?
we go, okay.
So ideally, when the blood dries on the slide, we want it to look more like this,
Yeah.
where there's a lot of black interconnection
Okay,
with a bright red color.
Yep.
If there's a lot of holes like this is where the inflammation is.
ah,
So this is actually where CRP is gathering and it can't clot very well.
okay,
Right?
all right,
So depending on where we see that, there's actually a ring pattern that shows different parts of the body.
okay,
So this kind of follows the chakras actually, and the
Okay.
center is our core,
yep,
and the outside edges is our skin and extremities.
interesting.
So if we see
Yeah.
Any anomalies, this helps us to see where it's occurring
Yeah.
so that we can direct
it.
treatment.
Yeah. Well, that correlates with some of Molly's testing,
Exactly.
right?
Yeah.
Which also correlates with some of the Mead testing, which is for the bioenergetic or the charge or polarity of the cell, right? Cells need a good polarity in order to function and heal, but as they become more damaged and less oxygen and more acidic, the voltage decreases too. So this all
Correct.
can correlate together, and
Yes.
a lot of times what will happen is it all correlates. Right,
Yes.
so Molly's testing, I had it done, the 3D body scan,
Yeah.
and liver was a big part of it,
All
believe it
right.
or not. So
There
I
you
know
go.
I have some things
Yep.
to work on liver wise. So I'll do a flush.
Yep. Okay, so the first drop, well, several actually, are too big to see the whole thing, so I'm just gonna kind of
Sure.
scan across.
Sure.
So this is what's considered like your skin ring, which looks fine. And then we're gonna go in from there just a little bit. So this is your lymph, which looks good. And this little marker here where you can see
Yeah,
this
little
little
line.
line and it's like a little brighter red.
Yeah.
That's an injury or trauma marker.
Interesting.
And whenever there's like a line, it usually indicates either scar tissue or subluxation.
Interesting.
And so if you
So
were
misalignment,
looking,
yep.
if you were looking at where this would be on your body, it might be like lower cervical, upper thoracic.
Okay.
It could also maybe be shoulders in
okay.
that same area.
Okay. So again, you're basically working from here
Exactly.
in. Yeah, gotcha. Okay,
Yep. So
great.
I don't know if that correlates with any kind of recent, because this is your most recent drop.
Most recent, yeah,
So it would be kind of maybe recent.
yeah.
you
Right,
know.
right. Yeah, just with the
Were you coughing
illness.
a lot with your
Oh,
with your
yeah,
chest cold?
definitely.
So you
And
might have
then
thrown something
The
up
left
there.
side
Yeah.
was real tight and tense,
Yeah.
for sure.
Yeah. Okay. And then as we go across, it looks really good.
And this is the first one still?
The first one.
Yeah,
This is
okay.
the very center.
Okay,
So this is looking really good. You have
Okay.
really low inflammation.
good.
Here's a couple of little almost holes where there might be some CRP, and this is more in. This one's kind of lungs. This one's kind of lymph.
Okay,
And
yep.
considering you've been fighting
Yeah,
something, that's
makes
very
sense.
minimal.
Yeah, okay,
Comparatively
good.
speaking,
that's
right?
good.
So that's good. And then back to the skin, which
This-
looks fine.
Gotcha,
Yep.
perfect, okay, good to know.
Yeah, and so the whole drop looks like that.
Okay,
Really very minimal inflammation, just a little bit through that lung and lymph area. But it can get looking really bad. Like
Sure.
it can look like the Great Lakes
really,
and
That-
have a lot
wow.
of holes.
holes, yeah,
So yours looks actually really pretty good.
okay, good to know.
So
There's hope.
yeah, no, you can tell you've been taking care of yourself, so. So this is the second
Okay,
drop.
Yep.
And again, a lot of good black cobwebbing. Yeah, this is the center, and so you have one kind of big hole just off the center. So that's your digestive organs. That's
Okay.
stomach, maybe small intestine, maybe
Mhm.
pancreas, something. Usually if it's liver, it'll have like a solid black line around the edge.
Okay.
So I don't
So
think it's the
maybe-
liver
okay.
necessarily, but
Some other things.
this goes back a little bit further, so maybe you ate something that didn't agree with you.
Sure.
Just a
Yeah.
minor digestive inflammation.
When you
marker.
say back a little further, how far would you?
Couple years maybe.
Oh, a couple
even.
years, okay,
Yeah.
alright,
Yeah.
gotcha.
So,
Yeah, fair,
and sometimes when it's minor like that, it's not anything that you necessarily remember.
sure,
Right.
sure.
So, and then again, we have maybe just a slight little injury in the knee ring.
The knee, yeah,
Yeah.
meniscus. I did my peptide shots and it's gone, so that's a little, we'll definitely do a cancer conversation on peptides, because I think that's an up and coming
Awesome.
treatment, just
Yeah.
a little caveat.
And this is further back.
Yeah,
So
okay.
this goes back
Yeah,
further.
it's been
Yeah,
10
so-
years.
yeah.
10 years on and off, started to do PPC 157 peptide, and it's totally, I have zero pain.
Okay, this is number 3.
Okay,
And this one in the center, you can see the teeny tiny little pinholes.
yeah,
That's called an allergy pattern or a
Mhm.
gut permeability pattern.
yeah,
And that's kind of what I see consistently when people are seeing fungus in
Yeah,
the blood as well
yeah.
that have this pattern, it correlates.
Okay,
Because sometimes those little junctions between the villi
Yeah.
just get weak or damaged,
Yeah.
and that's when it
things
escapes.
permeate through, yeah,
Mhm.
makes sense.
Yeah.
I would say that's accurate.
And that's really the only thing that shows up on this layer too.
Okay.
You have really low inflammation.
Yeah.
I mean, obviously, a lot of the patients that I see here are struggling with a lot more things than you
Sure.
are.
Sure.
So this might be like kind of boring in that
No,
regard.
no,
But it's still beneficial. It
Very
doesn't
much
matter
so.
where you are on your health journey.
Right.
You can always key in on what's better.
I'm working on prevention every day, right?
Yeah.
So these things that we're finding, I need to, before they turn into something, so my mentality is always early, and if we're on the wellness track, right? And this day and age, these are the tools that we should be utilizing, because if I eat well and exercise and take my supplements, that's good, but is it enough these days, right?
Right.
And we have the knowledge now to where I can do things like this. We can do this testing and the mead testing, and we can do Molly's testing, and more than just blood and urine, we can figure out more of what's going on. Even if it's minor, it still can turn into major, which then can turn into a major inflammatory producer, and that's
Right.
when damage happens.
Right.
So from a wellness standpoint, these for sure, or a
Yes.
reoccurrence standpoint,
Right.
this is how we prevent it or prevent reoccurrence and heal from it.
Right.
So it's applicable to everybody.
Exactly.
Yeah.
And this marker isn't exactly great representation too, because while we still see that gut permeability marker, this one again is going to go back to some kind of an injury,
Okay.
and because it has that line,
Yeah.
I'm thinking more spine, but
Okay.
you can see it's closer into the center, so it would be lumbar,
Okay.
and that would
Yeah.
be older
Sure.
in your history.
Okay.
But because the blood remembers that trauma, you could have a meridian that isn't passing electrons very well.
Wow. Just
That
because
can be
it's
corrected with the biomodulator
right.
to get those electrons flowing again. Because if those meridians aren't feeding the organs properly,
Right.
then that's when the disease process has the chance to start, because it's not getting the innervation that it needs.
See, this is good as it correlates with the cancer conversation tonight, because this is the detail
Yeah.
that we now know,
Yeah.
and we can go to
Right.
to actually get somebody from low functioning
Right.
to high functioning.
Yes.
And when you get somebody at the cellular level that high functioning by using tools like this and getting into the nitty gritty, you then change their cells. You change how their cells operate,
Yeah.
which means you create optimal function,
Right.
right? Optimal
Right.
function equals optimal performance, but really it means low disease states.
Yes.
That's really at the end of the day what it means.
Yeah.
So, this is fantastic. I love it. I think this should be honestly a requirement for every new patient that comes in here.
Okay, so this is the 5th drop now. So
Okay.
again, this can go half
Way
your
back.
lifetime ago.
Yep.
So we still see that gut permeability marker.
Yeah.
And that just is showing that it's been going on for
No,
a while.
and that's probably accurate, Ken.
And I have to say, it's probably the food supply,
Yeah.
right? Because no matter how well we try and eat,
Yeah,
I mean, the system is against us,
Right.
because the GMO foods are really
Sure.
designed to destroy our gut.
no
And
question.
so,
Yeah, I mean, you have stress is really a major player in the gut, right? But then you have the food supply, and then if you are dealing with things like candida or gut infections like parasites or what have you, that inflammation in the gut will break down, to Teresa's point, will break down the gut permeability or the tight junctions in the gut, and now you have things leaking through the gut that shouldn't, that get into the bloodstream, that then create an immune response. So
Correct.
you have inflammation and then leaky gut, and then malabsorption can occur from that. So
Yeah.
gut health, that's why gut health is just so important to stay on, in my opinion.
Yeah.
You know, your enzymes and your probiotics and your leaky gut support, which includes things like aloe vera and deglycerized licorice and marshmallow root extract. Not you have to take all
and
those, but
L-glutamine.
L-glutamine,
and-
yeah. Cancer
exactly.
patients have to be careful with L-glutamine just because
Yes.
it can beat
Right.
cancer. And then of course find the problem, or the infections. Candida, SIBO, parasites are huge. So if I can knock those out and support my gut with those other strategies, now I can heal the gut.
And when we see signs like that in this blood analysis, then we can also follow up with an F scan,
Yeah.
which identifies specifically the
specific parasites.
yeah.
Yeah. No.
And treats with the firefly.
It does. Yeah.
So,
Agree.
So this
Okay.
obviously jumps off the screen.
Yeah.
So that's actually a chemical marker.
Interesting.
So, and it's right in where your liver would be.
Interesting.
So this is like, can be half your lifetime ago. You
Okay.
might have had some kind of a chemical exposure at that time.
And excuse me, would you say chemicals like an environmental toxin,
An environmental
heavy metal?
toxin, maybe heavy metal, could be like a cleaning product.
Okay.
I had a patient the other day who
Excuse me.
he used to work on cars with
Sure.
his dad.
Sure.
You know, he said he was around those kind of like petrochemicals
Yeah.
like his whole life.
Whole life.
So there's lots of different things that can play into that.
Okay. All right.
It doesn't necessarily mean that there's anything going on now.
Sure, but it's just a
but
sign
it could
that.
be affecting how your liver's functioning.
Sure.
Right? And
Absolutely.
since we saw all those other signs.
Yeah. Yeah, and those are tests that I've been wanting to do anyway. So
Yeah.
toxins, chemicals, things like that.
This is number 6. And
Same area.
same
Same area.
area. It's just got that little bit of gut permeability.
Okay. And 7, right?
And number 7, you can see they keep getting smaller,
Sure.
so we're seeing more and more of it.
Yeah.
And so you can see or notice a little bit how the color is getting a little bit paler. It's not quite as bright red.
Sure.
So that's a sign that maybe you weren't getting as many nutrients
Back in
in the day,
Interesting.
right? Or maybe not absorbing them as well. Maybe
Right.
you weren't doing enzymes and things like that to optimize
Yeah.
your gut health back then.
Yeah,
So
sure.
even if you were eating well, you maybe weren't absorbing it
absorbing
as
it well, right?
Right? But people can sometimes have their blood look where it looks almost beige, you know.
Interesting.
That's the good thing is that now on the more recent layers here, we can see that it's nice, bright red. You're
Yeah.
absorbing and utilizing your
So we're doing
nutrients
better
much
than
better.
maybe years
Yeah,
ago.
Exactly.
Yeah. Should, right? With all the
Yeah, with all your knowledge and
Strategies,
strategies that you're applying, yep. So, but that confirms it, so that's good.
yeah.
Okay, so this is the last drop, and it's just kind of smudgy because I've already tapped your finger so many
Sure.
times.
Sure.
But again, it's got a little bit of that gut permeability and maybe a little bit more digestive inflammation there. But overall,
Okay.
you have really low inflammation and nothing like jumps off like this is really bad or
Sure.
anything like that.
Sure. But
But
strategies
it's
that I
given
can.
you some good
Yeah.
clues for tools that you can now follow up with
Yeah.
to get even better optimal health.
No, love it. That was excellent. Yeah,
Yeah.
that was excellent. I appreciate it. I appreciate it personally, but I think the audience will really enjoy this. I think this is going to be something that, again, we should probably adopt in the clinic. This will be a part of their initial eval and the follow-up process. I don't see how it
Shouldn't be.
shouldn't be,
Yeah.
right? So
Yeah.
we'll definitely work on that for sure.